Hello guys, and welcome to this video to learn how to teach the flossing procedure to your patients. So we are using here 25 to 30 centimeters of floss. You cut the floss and then we are going to rotate the floss around our middle fingers to use the index fingers like this or the thumbs like this on the upper arch, okay? So both of them can be useful, and of course you are going to place the floss between the teeth like this, and then you are going to rub the floss against the surface of the teeth. We need to do this twice, so in the distal papilla and then in the mesial side of the papilla, okay? As we approach the gingival level, we need to brush as a C shape, okay? So this is very important. We need to use a C shape, so holding the floss from the buccal and lingual positions to make sure that all the interproximal surface is being cleaned, okay? Now we repeat the procedure on the other teeth, all right? So let's see this from above now, from our occlusal view. So take a look at this. This is the C shape for the distal surface, okay? And then this would be the C shape. I'm using only one hand, that's why it's a little bit tricky here. But then we can also do this in the mesial. So first we are going to do the distal papilla. That's a mannequin. You shouldn't go too deep like this, all right? Only in the correct distance of your pocket, and then, yes, and then the C shape in the mesial position, okay? Never pressing too hard, okay, because you can damage the gingival tissues and the pockets, right? So never using too much pressure. In cases that we have this papilla, then of course this is a black space, so interdental brushes are better for the black spaces, and please check this reference because it's very useful. See you guys on the next videos.